Wonderful. Hello, everybody. Welcome. We're going to go ahead and get started. My name is Camila Davis. I'm the Perinatal Equity Initiative Coordinator for Santa Clara County. Hello, hello. So we're going to go ahead and get started. Unfortunately, we're having a little bit of video issue, but that may be resolved in the next few minutes. And if not, of course, we're going to keep it going and we'll still be able to hear from all of our special guests. So yeah, we're going to go ahead. I'm going to go ahead and just for those of us who, we have people who are very well acquainted with the Perinatal Equity Initiative, and then we have some guests here that may not be. So very briefly, I'm going to go over a little bit about PEI. So the California Perinatal Equity Initiative is a statewide effort to address the causes of persistent inequity and health disparities that threaten Black and maternal infant health. And we are also very proud to announce that the Deliver Birth Justice campaign is the first Bay Area-wide campaign featuring the stories and experiences of real Black families, Black mothers, Black babies in their perinatal journey. And so we also refer to ourselves, the PEI program, sometimes as the sister program to our sisters at Black Infant Health. And the Black Infant Health Program, as many of us know, for over 30 years has been trailblazing this work in the state of California to support our Black mothers and birthing people to address the stressors driven by structural racism. So of course, a big shout out to BIH, Black Infant Health, and we'll talk a little bit more about them at the end of the program. Okay, and then if we can maybe get started with the objectives. Oh, we might have lost the screen. Okay, so while we're getting the screen up, I just want to share a couple stats. And so again, many of us may know this, for some it might be shocking, but in the Bay Area, Black babies are 2 to 3 times more likely to be born too soon, too small, or to die before their first birthday. And then Black mothers similarly are 3 to 4 times more likely to die during pregnancy or childbirth compared to white mothers. These disparities, of course, persist despite the level of education Black mothers have, their income, where they live, or their health habits. And so many of us in this field are well acquainted with these statistics, although grim. And while these glaring disparities are the purpose of our work, we are also here to celebrate in community with you all the hope, resilience, and joy of the Black mother, the Black baby, the Black family. Awesome. And then we'll get started with the objectives. Hello. So today we will be elevating the voices of Black parents and families. We will be inspiring our audience members through hearing our community's experiences. We also hope to raise awareness of the Deliver Birth Justice campaign and the Black maternal health crisis. We also hope to learn about California laws and policies whose goals are to advance birth justice for Black birthing people. And we also hope to share some calls to action to support delivering birth justice. And of course, that is the theme of the event, is moving from this place of awareness to action. And for each and every one of us, there is an action item. Okay, and then why deliver birth justice? So Black mothers, babies, and families, of course, deserve to be healthy, safe, and supported throughout their birth journey and their lives. Yet all too often, racism is harming Black families' ability to have a safe and healthy pregnancy and birth. And in response to this crisis, 5 Bay Area counties, including Alameda, Contra Costa, Santa Clara, San Francisco, and Solano, have joined forces to launch Deliver Birth Justice in July of this year. This campaign aims to mobilize all corners of the Bay Area, from health professionals to policymakers to community members, to end racism and birth justice for Black families. Okay, and now we are going to get started with some opening remarks. Before we start, I'm going to go ahead and read a short bio of Dr. Zaya Malawa. I'm so honored and pleased to introduce you a woman who wears many hats including a pediatrician, a public health professional, a physician director, and our campaign's esteemed spokesperson, Dr. Zaya Malawa. She is a physician director at Expecting Justice, an organization dedicated to promoting perinatal health equity. And Expecting Justice is famously home to the Abundant Birth Project, which is a guaranteed income pilot for pregnant Black and Pacific Islander women in the city of San Francisco, and is expanding. Dr. Zaya is also a practicing physician at Mission Neighborhood Health Center in San Francisco and the Perinatal Services Director at the San Francisco Public Health Department. So without further ado, Dr. Zaya, go ahead.
Thank you so much, team. I am really thrilled to see how this work has come into fruition, and I'm really excited for this announcement. So thank you for this opportunity, and welcome everybody to this talk. I'm so glad that we can talk about the importance of birth justice together today. This work has been so long in the coming because for too long we've seen birth disparities unchanged in the Bay Area and throughout California. In fact, some of the other people who are working on this PEI initiative have also been working with me on a maternal health report, Black maternal health report that the California Department of Public Health will be issuing. One of the things that we learned through this work is that there hasn't actually been a report on Black maternal health in California for 30 years. But what I want to also point out is that 30 years ago, we were clear in California that Black birthing people were experiencing much higher rates of adverse birth outcomes. Unfortunately, 3 decades have passed and we haven't seen a significant difference. For too long, we have seen these birth disparities appear in our data year after year, and collectively, as a community, we have been very apathetic to fix it. Part of the reason why I suspect is because many people assume we see these disparities between white births and Black births because of behavioral choices that Black mothers and other Black birthing people are doing. Choices around how they're going to take care of their health, choices around how they're going to engage with the medical system. Also, people might assume that there's something inherent in being Black, something biological, something genetic that is driving these birth disparities. But what the research shows us, and we have mounting research that is increasingly proving this, that in fact, it is not choices, it is not DNA, it is not genetics, it is racism and the experience of racism that is making Black birthing people and their babies unsafe through the process of giving birth. And this racism costs all of us. Obviously, it costs the Black community because for so many Black mothers, birthing is no longer a joyful experience, it's actually a terrifying experience. I speak to so many women at the end of their pregnancy that are Black, and instead of feeling excited to meet their baby, they also are feeling incredibly terrified about what the process holds for them. It's also a cost in terms of the lives that are lost and the disability that is created through totally preventable adverse birth outcomes. And it costs us as a larger society, of course, too. It costs us in terms of healthcare dollars. It costs us in terms of lost productivity for parents who have to take care of newborns that were born premature. But most critically, it costs us morally. I want you all to think about what is the cost to our collective souls that we let Black babies and Black mothers die preventably at 3 times the rate of white people. And so I'm so excited today because Deliver Birth Justice is asking that we as a society, we go on a healing journey together. All of us have healing work to do in this regard. Medical professionals and healthcare systems, it's time for us to free ourselves of racism. And when we do that and we heal ourselves of racism, we are also healing ourselves of burnout. Systems leaders, politicians, it's time for you to heal the wound that is racism in our societies by choosing policies that create corrective actions, by funding projects that will actually start to create repair, by acknowledging publicly and validating the harms that past policies have done to the Black community and taking active and affirmative steps to fix those harms. And of course, Black mothers, you are going to take the chance to go on this healing journey with us and heal yourselves of the problematic narratives that have been created around you, around us when it comes to our birthing. Please heal yourself of the notion that there is something wrong with you, that you're doing something wrong, and that is why we see these adverse birth outcomes. Please heal yourself of all of the accusations that you are constantly having to face down as you try to do the best you can to take care of yourselves and your babies. When we as a society come together and we choose justice over the status quo, We are saving lives. We're saving babies' lives. We're saving mothers' lives. When we as healthcare providers choose to offer healing instead of accusation and discrimination, we're saving our own souls. When we as a society choose to stop tolerating this racist system and instead choose to center Black mothers, we're strengthening our society, the society that we all live in. Black babies matter. Black mothers matter. Let's get to work and let's get to healing. Thank you.
Thank you so much, Dr. Zaya, for that, and also, of course, for lending your voice to be a spokesperson for this campaign. And I especially appreciate, I cannot echo enough your inspiring words of, as you said earlier, this work is very urgent because people are dying. And as a mother who almost died in labor with my micro preemie, who is now thankfully a thriving 3-year-old, the work is urgent, and people are often not so fortunate. So thank you for that. So as we transition, I'd just like to do a quick shout out to all of our PEI campaign partners, including all of our counties, again, Alameda, Contra Costa, Santa Clara County, Stand Up, San Francisco, and Solano, and then also BARHII, the Bay Area Regional Health Inequities Initiative, who is our amazing partner. And without further ado, the video. Just give us a couple minutes while we queue it up. Everything has ads now. I remember when YouTube didn't have ads. It was not long ago, maybe like 7 years.
I've been placed in high stress situations with each of my pregnancies, but the one that stood out the most for me was my second pregnancy. Our experience was so horrible and traumatic that we ended up with a second cesarean. Once the baby was here, they'd take the baby to the NICU, but no one would communicate with me. I didn't find out till later on the baby and I had a fever. We had situations with nurses. They had us pegged, like they gave us this feeling like we were bad parents. I go into all my pregnancies worried, like, am I gonna
white women to birth in this country than Black women. And that's represented by maternal mortality statistics that are often 2, 3, or 4 times higher than that of white women and white birthing people. Racism is harming our community and harming our ability to have safe and healthy pregnancies and births. In the Bay Area, we have decided to create Deliver Birth Justice as a way to bring the Perinatal Equity Initiative to our 5 counties. And this campaign is really an effort to help people understand what Black pregnant people are facing on a day-to-day basis so that we can move into a space of recognizing that dismantling racism is the only solution.
It's so important for us to have advocates and for us to know that we deserve to have a healthy birth and our babies are going to be well taken care of and that we're not overlooked.
Being diagnosed with Graves' disease, I went out of work on disability. My doctor looked at me as like some poor little Black girl that just was trying to work the system.
I'm a healthy woman, fully capable of carrying out a normal pregnancy. I had to have an emergency C-section. I wear a 5-inch scar on my body, and I can't fully explain why.
I got home from the hospital, my leg swelled up. That night, my sister quickly took me to the hospital. I was there for a week and a half to basically be treated for the post-preeclampsia that I went through. I feel like because of the whole experience from the very beginning, of me being induced and all of that, that whole experience didn't have to happen.
A lot of times we want to attribute some of these differences that we see in birth outcomes to different kinds of choices that Black mothers might be making, or different kinds of unhealthy health behaviors that Black moms might be engaging in. But science shows us this is very much due to structural racism and the kind of racism that moms face when they go to the physician, seek out help from social service providers, when they're interacting with other institutions like our educational systems and criminal justice systems. These racist interactions that are happening, all of this leads to a cumulative amount of stress that moms face, not just during pregnancy, but leading up to their pregnancy. And this cumulative stress is making it very difficult for Black birthing people to have healthy pregnancies.
I think we've witnessed so much trauma of what it feels like when Black lives aren't valued. Hopefully people will start to understand that valuing Black lives starts at the beginning.
There has to be more accountability behind this. Anti-racist trainings and more Black doctors. I feel like systemic racism just really needs to be addressed. We gotta listen to Black moms.
And so what I really hope through this campaign is that we inspire providers to really understand the ways in which perhaps their racialized socialization and their implicit bias, and maybe even their explicit bias, is really deeply impacting the lives of the Black community. I also hope that this helps policymakers understand that they have a role to play in this, that policymakers can absolutely change the trajectory of a Black mother or a Black baby's life. And they can do that by creating policies that dismantle structural racism.
Black mothers need better housing and better jobs.
We are absolutely amazing. We are warriors. We are strong. Without us, the world does not go round. So Black mamas are queen. We are it. We are everything.
Every single time we dismantle structural racism, we're saving a Black mother's life. We're saving Black babies' lives, and our lives matter. So this work is something that we all need to take on right away.
I just encourage everyone to learn more about the Deliver Birth Justice campaign. See us, hear us, know our stories, and help uplift us.
Awesome. Yes. And a very, very special thank you, of course, to all of our mothers who shared their stories and shared their families with us to create this beautiful, beautiful video. And then also a shout out to our other esteemed spokesperson, Goapale. And so I'd like everyone to take a moment for those of you who have seen this video before, or for those of you who are seeing it for the first time, to just drop some comments in the chat about your reaction to the video. Whether it was uplifting, whether it gave you any other kind of strong feeling, or we'd love to see it in the chat. Yes, and it is a very powerful video. Very, very powerful. Wonderful. Wonderful. I see powerful, yes. And agreed, this does need to be shared everywhere. And all of you can be a part of that by sharing our campaign materials, following us on Facebook, on Instagram. Yes, definitely the information can be shared, and that's the whole purpose, is to raise awareness to the people that can really make a difference. And yes, and I see, how did we allow this to get so bad? Totally agreed. I think that's a rhetorical question, but I mean, as we know, research has shown that really the root cause of this is structural racism. And it's until we kind of focus on that and everyone is committed to that, whether that's accessing anti-racism or implicit bias trainings, or, kind of educating yourself in different ways and committing yourselves to kind of fighting anti-Black racism in this country. I think that's the first step. Wonderful. Okay. Yes. And then I also see we have to address the root causes and educating medical schools and nursing schools. Awesome. Wonderful. Okay. So without further ado, we're going to go ahead and get started. So like I said before, Black Infant Health has been doing amazing work supporting mothers and tackling this issue in a culturally congruent way. And for anyone who maybe has never heard the word culturally congruent before, it is pretty much FUBU, for us, by us, when your service provider is similar to you culturally. And so PEI work has been complementing those interventions with 9 different interventions that differ from county to county. And right now we're going to present what each of us have been doing in our respective counties. And first up is Ms. Dafina Melbourne from Alameda.
Hello, everybody. Thank you so much for joining us today. I know we are experiencing technical difficulties, so if at this moment you feel like taking a deep breath, please do so. We are here to celebrate the Deliver Birth Justice campaign, and I am so honored to be here to share what Alameda County is doing to deliver birth justice, and so excited that so many of you have joined us to really hear about how we can have an impact on birth outcomes. So again, my name is Dafina Melbourne, and I'm the Perinatal Equity Initiative and Reproductive Equity Coordinator for Alameda County's Maternal, Paternal, Child, and Adolescent Health in the Alameda County Department of Public Health. So one of the things that we decided to do initially with our PEI campaign was to bring our community together, and we mean community in an expansive way. So as you can see on the list in front of you, we have Black birthing people from Alameda County that give their input and their expertise on what we're doing as an initiative. We have birth workers, we have healthcare providers, we have insurance providers, we have community-based organizations, and we are always open to more Alameda County participants to join our PEI steering committee to really help us continue to shape and mold what we're doing to have an impact on Black birthing people's outcomes in Alameda County. We also have a doula advisory board. So as you all know, California just signed SB 65 into law, and you'll hear more about that later. However, part of that is making sure that Medi-Cal eligible birthing people have access to doulas. And so before this work began, we decided that we were going to provide doulas in our county to Black birthing people. And we are starting our work by talking to doulas and finding out what is the work that they do, how do they do it, how do they work in community to provide so much rich, amazing care to Black birthing people. And so who was on our doula advisory board? We have, again, Alameda County Black birthing people. We have independent doula contractors. We have doula collective providers and their members. We have international board certified lactation consultants. We also have our doula coordinator at the table who manages these meetings. We have amazing consultants at the table, and I also sit at the table to really draft what we're going to do to be able to provide this care in a way that is respectful to our birthing people, but also to our doulas as professionals. So we are launching in the spring of 2022. This will be our pilot year where we will be supporting Black women and birthing people in 3 key programs. So the first program that they'll be able to access doula support through Alameda County is with our beloved Black Center and Group Prenatal Care Program, which I'm going to talk about a little bit in the next slide. If you're receiving or birthing within Highland Hospital's care plan, you have Alameda County Black Infant Health, and we also have Santa Rita Jail's incarcerated women and birthing people. These are the 3 areas where we'll be first providing doula support. We're going to offer full spectrum doula care, which includes abortion to miscarriage, postpartum care, and everything in between, labor and delivery support. So any and all aspects that a doula can show up to support our birthing people is where we want to show up. More about our group prenatal care program. So it is our Embrace Her Perinatal Services, which offers 3 different components. The first component is group prenatal care. And this is offered to people who have Medi-Cal or some form of Alameda Alliance insurance coverage who are being seen at the East Oakland Clinic in Oakland, as well as West Oakland services, as well as at Highland Hospital. Enrollment begins around 12 to 20 weeks. We want you to get in as soon as possible, but if you are over 20 weeks, we do not deny services or support, so you can still access it. We want to make sure that you get the full benefit. And what pregnant women and birthing people are going to receive are prenatal care that reflects your cultural experiences, your midwives, your lactation consultants, your doulas, your care coordinators all reflect Oakland and reflect Oakland's Black population. You will also get your prenatal doula care and support, labor and delivery, postpartum. You have lactation support and one-on-one support with an amazing Black lactation consultant that works at Highland Hospital. And you have parent and newborn supplies provided to you to kind of cut down on that new parent cost. And then support accessing other programs in Alameda County, like the Fatherhood Initiative and other initiatives that we have that are really meant to hold the entire family. After you give birth, you have access to 2 other programs, Mom and Baby Embrace and Polish Your Crown, Sis. Mom and Baby Embrace is really meant to help you navigate those early times after baby comes home about how am I going to raise my child? How am I going to rear them in a way that's respectful to my culture, and may also engage in other practices that you may not be familiar with, and also a safe space for you to talk about being a parent in this environment. And then we have Polish Your Crown, Sis, because we know that everything does not revolve around your family. Some things really truly need to be focused on you. And so this is a space where you can come and talk with other Black women and birthing people who are just trying to level up with their mental health, their self-care, and all the things in between. So these 2 programs are complements to the group prenatal care program in Alameda County. So I'm going to now pass it on to my colleague, Natalie Burbick, to tell you what's going on in Contra Costa County.
Thank you so much, Dafina. I am thrilled to share about the incredible work that is happening in Contra Costa County to support Black birthing people. And we have a number of things that we're doing in our county, not just within the Perinatal Equity Initiative, but within our hospitals and clinics and with other community-based organizations. So thank you so much for this opportunity. I would love to start with the fact that Contra Costa County started with the community members to drive the work that we're doing today presently. We met for about 1.5 years before we actually started implementing some of the services that were identified by the community members to support Black birthing people and Black families. We were intentional about making sure that we did a cross-section of moms and dads. We were looking at healthcare professionals, public health professionals, early childhood professionals, folks who are midwives, doulas. We were intentional about making sure that we had everybody sitting at the table who either supported Black birthing people or who were directly impacted by these adverse outcomes that we're trying to reduce through the Perinatal Equity Initiative and the Deliver Birth Justice campaign. We wanted to make sure we had a framework that was meaningful. We didn't want it to just be another meeting. We wanted our board meetings to be reflective of the passion and the intent to really uplift the experiences of Black birthing people and to make sure that they felt loved and connected and cared for through what offerings we're offering through this initiative. And we really drew down from their wisdom and their lived experiences to really guide us and to make sure that we're on the right track and to hold us accountable for. So I want to shout out all of the board members who are on this call today. We would not be here without you. Next slide, please. So out of all of the work, we identified 2 interventions that we were really feeling spoke to and met the needs of Black birthing people. And we identified the COCO Doulas program. We don't have a lot of doulas in Contra Costa County that serve those who may happen to be low income. And so we were, through the Perinatal Equity Initiative, we were able to provide free training for doulas in our county. We had 14 doulas trained, and out of those 14 doulas, 4 have become doula fellows, and they're receiving compensation through the funds that came through Perinatal Equity Initiative to do prenatal home home visits, support during prenatal exams, birth planning, labor and delivery support, breastfeeding assistance, infant care, depression screening, and linkage to other health and social services. And basically, it's another sister helping another sister in community. And that speaks to part of the work that Black Infant Health is doing. We're trying to replicate what we know works through the Cocoa Doulas program. And the next program that we are also funding in our community is our Partners in Pregnancy Fatherhood program. When we did our focus groups, we found that the partners were getting little to no support in our county. The birthing people, the mothers, they said very clearly in the focus groups that their partners had no support and they were looking and seeking it. So through this program, dads could come together, they can have support groups and get one-on-one support through a father engagement specialist. And we are especially targeting Black fathers who are also subject to structural racism and the chronic toxic stressors that impact their experience and possibly impact their family's experience. So you can't just support one person in a family, you have to support the entire unit. That's ideally what our board was looking to do based on our exploration of the issues in our community. And the next slide, please. I would like to proudly announce that in Contra Costa County, our Board of Supervisors have proclaimed today, November 3rd, 2021, to be Black Family Health Day in recognition of the work that's happening in the Perinatal Equity Initiative. And our county has declared racism as a public health crisis. And this is one of many interventions that is acknowledging it, calling it out, and recognizing that in order to shift these outcomes, we need to start from the top down. We can't just look at a Black birthing person and say, you need to change how you eat. You need to change your exercise regimen. You need to, and we really need to elevate the conversation and look more upstream about what are the causes of the causes as to why Black birthing people are not as healthy or not as well during the perinatal period. We need to look at what are the structures, what are the policies that upheld white supremacy, the patriarchy, capitalism that really drives some of the stressors that play out in our health outcomes and have been doing so for generations. We need to look and think upstream. And so our county is recognizing that our systems need to be disrupted and changed. And so they have proclaimed today as Black Family Health Day as a step in the direction that we're looking to go to really recognize that racism needs to be abstracted from our systems. And if you have any other questions about our work in Contra Costa, you can reach out to me and I'll make sure you're linked to our services that I've mentioned previously. And I'd like to introduce our next presenter. From Santa Clara County, that's Camila Davis. You've been hearing her voice, and she's the Perinatal Equity Initiative Coordinator in Santa Clara County. Camila?
Thank you so much for that. Yes, Santa Clara County, stand up. My name is Camila Davis. I'm going to share a little bit about what's going on in our county in terms of PEI and Black maternal health. And I am so very excited to share some of the support that our wonderful Board of Supervisors have given us. So they have increased the budgets for the BIH and PEI programs and also approved a work plan to strengthen the network of support for Black mothers in Santa Clara County. So this work plan, just to summarize, included 4 strategies based on community feedback, rooted in community feedback, which was increasing public awareness, like using campaign materials such as ours, expanding support systems, which is augmenting the services already offered by Black Infant Health, as we all know, and PEI, and also establishing new ones, such as birth classes, of course, culturally specific birth classes, peer support programs, and mental health support. The third part of the work plan, the third strategy, is about changing policies and systems to improve outcomes, which is heavy in engaging system partners and implementing policies that address implicit bias and unequal access and anti-Black racism. And then also the data evaluation piece, which is so important, as we've discussed today, in tracking our progress and developing accurate metrics for success. And then I'd also like to do a special thanks and shout out to our board vice president, Susan Ellenberg, for her passion and advocacy for Black mothers and babies in Santa Clara County and all over. So that is one of our updates. And then just shortly about our interventions. So we partner with Roots Community Health Center. Some of you in Alameda County might know of Roots Community Health Center in Oakland. So luckily, years ago, we also, the South Bay Clinic was established, and it has been an invaluable community resource. Through our partnership, they've developed the Women of Wellness program. And so the Women of Wellness program has the goal of education, motivation, and providing support for Black women in Santa Clara County. And it's a 2-part program. So the first part is group wellness activities. And this promotes preconception health, which is one of our chosen interventions. And this includes a 6 weeks fitness challenge. I have a flyer for that in the next slide. We also have our event, Let's Talk About Sex, which is a contraception education program. We also have a cook and chat featuring our registered dietitian, Jocelyn Dubin, who may be on the call now, and then also Wellness Wednesdays. And so all of the preconception health events are interactive in a virtual group setting. I've gone to many of them and they are awesome. And so the second part of our intervention is personal support, which we know is effective in tackling this issue as evidenced by Black infant health. And so the Women of Wellness iteration of personal support is maternal navigation, which includes one-on-one support, connecting women to resources, and also goal setting led by the women. And they talk about physical health and nutrition, self-care, of course, and family planning. And next slide, I'm going to show just a couple flyers for some of our upcoming events. First is the 6-week virtual fitness challenge. All women are encouraged to attend. It is awesome. It's led by our fitness coach, Coach Nina, who is awesome. It's a great workout Fridays at 3:00 every other week. So these are the dates. If anyone's interested, more information can be found, of course, on our website. And then just for everyone, just a note, if you're from Alameda County or Solano and wondering, oh, wow, I'd love to see more about what our counties are doing, please visit our website, deliverbirthjustice.org, scroll to the bottom, and where you see your county logo, click on it and you'll be redirected to some of these awesome resources. Thank you. And then the second one I'd like to plug is on November 11th. It's called Hey Sis, Let's Chat. It's a viewing party of a podcast that our partners at Roots Community Health Center are doing, and it's on November 11th. And that concludes my portion, and I'd like to introduce Dr. Angelique Anderson from Solano.
Thank you so much, Camila. Good afternoon, everyone. I just want to give some updates with regards to Solano County. With regards to Solano Hills, it's an upstream initiative that is a collaborative among community members, community organizations, medical providers, and public health staff. The mission of Solano Hills is to address perinatal disparities and disproportionate outcomes that adversely impact Black birthing persons, infants, and their families. The community brainstormed and landed on 3 strategies to address these concerns. The first strategy that I want to let you know about is our All Black Centering Pregnancy Group, which is an All Black Centering Pregnancy Group that allows Black moms to be involved in their birthing process, to have supportive care with both their provider and other women that are also in similar gestational ages with their babies. And it gives them an opportunity to learn about their health and take a huge role in doing that through weighing themselves, learning how to take their blood pressure, and taking a lead in their health. Our second initiative is our mental health toolbox, which is for our consumer and providers. It provides technical supports and also screening tools for both consumers and providers, and it's located in our website. And lastly, we want to give an update with regards to our implicit and anti-racism training for our medical and dental providers. Through that, we offer technical assistance and offer a train the trainer opportunity. Thank you for the opportunity for this update for Solano, and I'd like to pass it over to Michaela Merchant, who's our San Francisco Perinatal Equity Initiative Coordinator.
Hello, everybody, and welcome. My name is Michaela Merchant. I'm the Perinatal Equity Initiative Coordinator for San Francisco, and I will talk about our 2 interventions here in San Francisco County. Our first one is with Sister Web Doula Network and the San Francisco Department of Public Health Nurses Collaborative. These are wraparound services where the Doula Sister Web program and the public health nurses tailor a plan to serve our African American birthing population. Clients enrolled in this program benefit from services including referrals and linkage, support for moms to make informed decisions, massage, breastfeeding, and a holistic approach from the doulas, as well as they get a public health nurse that is able to visit them in their home and visit and provide services to the family in their setting of choice where we bring the care to them. So this program is also included is nutrition, vitamin, and the public health nurse and the doula collaborate to see who best messages certain topics about pregnancy, who's has the connection with the clients the best to actually be able to make sure that it's a healthy pregnancy. Our next intervention is implicit bias. Some of you folks may have heard about this implicit bias work that is going on throughout the country and throughout the state. Our specific implicit bias is a partnership with UCSF Preterm Birth Initiative, DPH, and Dr. Karen Scott. Dr. Karen Scott is a doctor that is an obstetrics and gynecology doctor and specializes in the ethics and science of clinical practice and teaching intersections of critical and cultural anthropology through public health. Dr. Karen Scott is creating a tailored plan where she goes into the hospitals and into the community and gathers data about Black women's birthing experiences and is able to then report back and tailor a plan for implicit bias training for medical providers, for hospitals and other institutions. Dr. Scott's approach is not a one size fits all. Therefore, there's an assessment period where she sees the readiness of each hospital and each institution that she's kind of working with and is able to give them something that is useful, tangible, and reflective of the community's needs and asks. We're going to move into talking about some of the policies that are going on. I'd like to start with, before I introduce Onyemma, I would like to talk about SB 464, which was passed in January of 2020. And this is prenatal healthcare facilities are mandated now to offer some type of implicit bias training to healthcare facilities. California Attorney General Rob Bonata sent out a letter recently in August to 191 perinatal healthcare facilities in California to inform, engage them where their facilities were at with complying with this SB 464. Implicit bias shows up in many aspects of our life, as I'm sure you guys are all aware of. It can be not just in the obstetrics world, but it's also in housing, education, environmental racism, and most systems that you can think of. Evidence shows that the implicit biases significantly impact our interactions between healthcare providers and actual health outcomes. With that, I would like to introduce Onyemma Obiekea. Obiekea, please correct me if I said that wrong, from the Black Women of Wellness of Los Angeles County. And she has a presentation that she's going to share with you all.
Good afternoon, everyone. My name is Onyemma Obiekea, and thank you very much for that lovely introduction. I am a policy analyst with Black Women for Wellness and Black Women for Wellness Action Project. And I'm very, very appreciative of you having me in your space today. I'll just give a brief introduction of SB 65, which is the California Omnibus Act. It was signed into law just on October 4th of this year, and many of its components will take effect in 2022. So I will just share a bit of information about SB 65. And so, but before we go forward, I'd just like to share a bit about Black Women for Wellness and Black Women for Wellness Action Project. We are a reproductive justice organization based in Los Angeles, California, but we also have an office in Stockton. And so we do have a statewide presence. Black Women for Wellness is the 501c3, and I like to share a story about the organization and how it began. Before it was officially a 501c3, it began as with a grassroots program called the Shangazi program. And Shangazi is a Swahili word that translates to aunt in English. And so what this program did was it paired pregnant people with mentors, and these mentors would provide support for their mentees, their pregnant mentees, up until a year postpartum. And so that's how Black Women for Wellness got its start. And just about 4 years after implementation of the Shangazi program, it then officially established itself as a 501c3 in 1997. And Black Women for Wellness Action Project is the 501c4 arm of Black Women for Wellness, and its mission is to build the political and electoral power of Black women throughout California. And from there, from the 501c4 is where we do a lot of our policy work as well as our electoral work. And just some fun facts about the C4: it was established in 2017 in the wake of the Trump election, and really is a direct response to it. And it's the first Black RJ 501c4 in the country, and it's the only RJ 501c4 in California. And so I know that I've said reproductive justice, and I know that I'm in a space where folks are familiar with the term, have some exposure to the term, but I always find it good to remind folks of the definition that we understand as reproductive justice, and because this definition really does ground our work and informs the legislation that we pass, right? And so this is the definition that we go by. It was coined by, and this term was coined in 1994 by a group of Black women in Chicago. And RJ is a framework that's grounded in human rights. It analyzes how the ability of any woman to determine her own reproductive destiny is linked directly to the conditions in her community. It addresses social inequality, specifically the inequality of opportunities that prevent us from exercising control of our reproductive destiny. I will say that, I'm using the term women because that's just, this term was coined in 94, and historically that was the term used, right? But we definitely recognize we are expansive in our language these days, and we talk, we have an expansive view on gender and identity, right? So we're fighting for folks, we're fighting for all folks, right? To have control over their reproduction and reproductive destinies. And so at the core of reproductive justice is the belief that all women or all people have the right to have children, the right to not have children, and the right to nurture the children that we do have in a safe and healthy environment. So it calls on the system within which we live, our government, right, to take responsibility and provide those the basic necessities for us to make these decisions. And so like the public health approach of health in all policies, where the goal is to integrate public health principles and interventions in policymaking, Black Women for Wellness and the Action Project take a reproductive justice or an RJ in all policies approach, so as to ensure that we advocate for and advance policies that are holistic, intersectional, and reflect the basic tenets of this framework. So I just wanted to share that a bit. Next is just a slide that and just the presenters before me have already painted this picture, so I won't spend time on this, but I find this visual helpful, and I'll just skip to one update I did want to make was the California Department of Public Health did release a report in September or early October that actually revealed that racial and ethnic disparities in pregnancy-related mortality ratios widened actually between 2008 and 2016. So from 2014 to 2016, the pregnancy-related mortality ratio for Black women was 56.2 deaths per 100,000 live births. And that's 4 to 6 times greater than the mortality ratios for women of other ethnic groups, right? And so for white women, that number is 9.4 deaths per live births, per 100,000 live births. Let me remind you that Black women's is 56.2. And so we're only seeing a widening disparity. And so though as California, we like to, commend ourselves for making great strides in maternal mortality and making an impact, sure, the chart on the left shows that, right? It reveals that we're performing, at least up to 2013, we're performing significantly better than the rest of the country. But I juxtapose these two charts next to each other because then we look at California. Within California, the racial disparities are great, right? And so it reveals that California still has a tremendous work to do, which is why we're all here, and which the presenters before me have shared. So I'll just go on. One more thing about the landscape is that speaks to access to providers and perinatal care providers is I wanted to share a bit about the landscape of midwifery care in California. I know I'm speaking to more so a room perhaps of doulas. But California is heading towards a maternal health crisis with critical shortages in maternity providers predicted by 2025. Currently, California has at least 9 counties that do not have a single OBGYN. So it's critical that we shore up like the midwifery workforce and doula care services so as to provide access to everyone who needs. And we know that, that we have better birthing outcomes, or, the studies show that there are better birthing outcomes, or, great, wonderful birthing outcomes with, with births that are attended to by midwives. And so, and this will all make sense in a second. And so this is not all the legislation that we have led, sponsored, and passed, but these are 3 of the pieces of legislation that we have passed that are directly relevant to improving maternal health outcomes in California. So, SB 464 was just mentioned, right? And that was the California Dignity in Pregnancy and Childbirth Act. And that was authored by then Senator Holly Mitchell. Now we have her in LA County as our fierce supervisor, which was signed into law in 2019 and took effect in 2020. And this legislation truly incorporated and mandated RJ-based trainings for perinatal providers. And so 2020 threw a wrench in the implementation of this, but I'm so happy to hear that various counties are engaging in this work. And yes, Attorney General Rob Bonta's letter was also referenced right before me. So the work is happening. And then we have SB 1237, which is the Justice and Equity in Maternity Care Act. And that was by Senator Bill Dodd, signed into law 2020, took effect 2021. And this removed the physician supervision requirement for nurse midwives that allows them to attend to low-risk pregnancies without physician supervision. And so the goal of this bill was to really expand access to those maternity to perinatal care providers by removing the concentration of nurse midwives in areas where there are already providers, right, or medical OBGYNs. They're now able to practice in areas that are the so-called maternity care deserts. And then we have, of course, SB 65. And so that I will get to it, forgive me, I'll move quickly. So SB 65 SB 65 is the California Omnibus Bill, and this was co-sponsored by California Nurse Midwives Association, NARA Pro-Choice California, the National Health Law Program, oh goodness, my timer is going off, Western Center for Law and Poverty, and the Women's Foundation of California, and March of Dimes. And so these, on this slide, just outlines what the goal, initially, what the bill set out to do. And then the current status. Early in the legislative cycle through the California budget, California did make essential investments to address the high maternal and infant mortality rates of Black birthing people by including significant pieces of SB 65 in the budget, right? So there were some budget wins, which include a guaranteed income pilot that prioritizes pregnant Californians. We've talked about this already on this call, but Medi-Cal coverage for doula services, and so currently I have to name this, there's a fierce group of advocates that include doulas, providers, and birthing experts that are meeting with DHCS to inform the implementation of this benefit. We're hoping that DHCS listens and pays attention. But there's this work that's happening behind the scenes with the goal of this being implemented by July 1st, 2022. Another thing that there's also, of course, the extended Medi-Cal eligibility for postpartum people. So all, eligible pregnant people will be able to stay or be able to be remain covered by Medi-Cal for up to 12 months postpartum, which is significant because it used to be 60 days unless you had a maternal mental health diagnosis. Let's see. And so we'll just move on quickly to so we enjoyed those budget wins, but then there still remained work to be done. And so the components of the bill that remained and that were signed into law eventually on October 4th were one, the component that codifies and expands California's pregnancy-associated mortality review committee to investigate maternal mortality and morbidity and make recommendations on best practices to reduce maternal and infant deaths. And so part of what's good, the act does a number of things, right? The state is now tasked with establishing a committee of community members and healthcare professionals to collect this data and examine the role of racial disparities in maternal deaths and severe injury. And the act actually enumerates a minimum of 13 members, which include at least one doula, at least one person from a community-based organization that works in perinatal health, a clinician or patient advocate from a birthing center, at least a public member with relevant personal experience related to maternal morbidity or maternal mortality, who has experienced birth and does not fit in another classification. And so in addition to, nurse midwives, licensed midwives, OBGYNs, the state is really tasked with creating a diverse body of folks to really examine this issue and publish results. And so it also establishes a stakeholder work group to aid in the implementation of the new Medi-Cal doula benefit, set to start in 2022, update data collection protocols for counties participating in the fetal and infant mortality review process, and clarifies that pregnant people are exempt from CalWORK's welfare to work requirements. And then it also builds the midwifery workforce by establishing a fund for midwife training programs that prioritize admitting underrepresented groups. We talked about cultural concordance, and those from underserved communities. And so I'll just end there, but just wanted to share that BWW has worked on maternal health since its inception, and we are committed to this work. And so we do engage community members in our policy work, and pre-COVID have taken up to 80 women at a time to the state capitol for committee hearings. And so, we welcome folks to remain engaged and remain plugged in with our organization as we do share updates. And I noticed some familiar names on this call. And some of you all have been just really fierce advocates helping to move the needle with regard to SB 65 and other policies that we have been co-sponsors on. So thank you very much for that support. And we welcome folks who are interested in becoming engaged. And so, although the bill accomplishes a lot, hence the name Omnibus, we were unable to include so many crucial provisions that prescribe interventions to address other critical factors that impact maternal outcomes for our communities, such as childcare, housing, climate change, and more. So we do look forward to building on to the policies that already exist, such that we can address the issues. And here is my contact information. I know I've run over my time, please forgive me, but if folks want to follow up with questions, get engaged with Black Women for Wellness or Black Women for Wellness Action Project, you are more than welcome to email me and I will do my best to respond. So thank you very much for your time, and my apologies for going over.
Thank you, Onyemma. That's amazing work sharing with us. That legislative piece is so important, and thinking about moving some of our policies into action and action into policy. I'm going to go ahead and introduce our next speaker. This is Melissa Jones, who is a part of BARHII, the Bay Area Regional Health Inequities Initiative, and they were a partner with us in this Deliver Birth Justice campaign. And she's also going to talk about some of the policies to action that and stuff that's going on there.
Yeah, wonderful. Thank you all for having us here to talk about this piece. And, I know I'm looking at the participants on the line, and so I know there are people who have been involved in Black infant health programs for a long time, and some people who are new to that, who are different parts of the county or different parts of the community. And I think it's so important to see the depth of resources we have here in the Bay Area to make change. And so next slide, please. And BARHII is really all about that. We're the coalition of the Bay Area's governmental public health departments. Our function, we were set up by the health departments to focus on the range of issues that impact our health that are different than healthcare. And so we spend a lot of time on a set of policy priorities that make a big difference in how families experience the Bay. And so we've been particularly focused for the last few years on two big issues: housing affordability, which we know has had huge impacts on all of us across the Bay Area, on families all across the Bay, about where we live, where people decide to move, how stressed people are in terms of family budgets, and then also on COVID-19. And we've been able to put together coalitions to tackle some issues that feel otherwise on their own very difficult to impact. And so the first example of that is in housing affordability, where we've been part of several campaigns over the last few years that have done things like pass anti-rent gouging legislation statewide. That was able to limit statewide the amount that anyone's rent could be raised at any given time. It's really important because across the Bay Area, I'm sure we all have heard these stories of or seen ourselves that there are landlords and others who have purchased properties and then tried to double people's rent. Well, those kinds of purchases and actions are no longer legal in California because of that. We also did some work during COVID-19 to help pass COVID-19 eviction moratoriums. So 100% of the counties in the Bay Area passed a countywide eviction moratorium. That means that people couldn't be evicted during COVID-19, so that housing stability would be strong even when incomes might go up and down because of closures during COVID. And we think that was a really important shift and change. And that we did by sharing data on public health, like the Federal Reserve report that's listed here and shown here, which showed the impact of housing affordability on families across the Bay Area, and then worked with elected officials to help make those make policy decisions that would improve safety and health for families. The other thing we did during COVID-19 in addition to focusing on eviction moratoriums, is really focusing on equity in response to COVID, so that everyone got information about masks, more people got information about vaccines, that vaccines could get out to the places that are easier, so it would be easier to get them, like getting out to neighborhoods or workplaces. And we did work to keep the parks open. You might remember at the beginning of the pandemic, there was some park closures and parks started shutting down. So BARHII board members and the parks directors across the region sat in meetings where they planned how to keep the transmission risk down for COVID-19 and keep the parks open. And so you might remember parks started to reopen, and then they stayed open here across the pandemic, which is different than in a lot of places in other parts of the country. And we really wanted that space to be available for families to relax, to have some place to go, to be able to exercise the range of things. And then we supported waivers for guaranteed income pilots that were being implemented across the region, including one being led by Dr. Zaya, who talked earlier, and made sure that as those income pilots came online, there were ways for people to get full access to both the income pilots and their existing benefits. Next slide, please. So we think the next layer of work for all of us is to make sure that this unprecedented investment that's coming federally as part of the relief for COVID and the new infrastructure recovery that will come later includes a focus on equitable distribution of resources, so that Black communities, Pacific Islander communities who have been hit so hard during the pandemic receive resources both direct to families and also to Black-led organizations serving in the region. And so we've put together, early in the pandemic, we put together a rapid response guide, and now we have an equitable recovery guide, and that's available on our website and posted here, that has principles about investment, strategies to put together an investment that's going to work best, and some other resources and examples of programs that can help. Next slide, please. And lastly, but not least, I think the most exciting thing, other than the Perinatal Equity Initiative that we're working on at BARHII, is really getting serious about a regional Black housing agenda. Across the region, I think many of us know the San Francisco of 30 years ago is no longer. So much of the Black community has left San Francisco. That's also true in Berkeley, and increasingly that's true here in Oakland. And we've never had a regional strategy to stop the loss of Black population across the Bay Area, and we've never had a strategy that fully incorporates why we're making the choices we are in moving. And so we have pulled together Black-led finance groups, Black-led housing groups, Black developers to talk about what it would take to have a strategy that retains our presence here in the Bay Area and strengthens our ability to stay. And so they have come up with a request that we have shared now with the governor's office, with the state assembly, and with local elected officials across the region for a Black housing agenda strategy. We're beginning a process and have started to host meetings to help Black-led organizations understand how to access resources to increase the amount of housing available that fit the priorities for Black communities across the Bay Area. And so that is a big piece of work we'll be moving forward that we would love to move forward in partnership with perinatal equity and Black infant health programs across the region as a strategy to really create stability for us as a community. And so I think I'll stop there.
Thank you, Melissa. It's been so great to partner with BARHII. Here's Melissa's contact information. It's included in the slides. Really great work and advocacy. Happy to have been able to partner with everybody. For our next part, I also wanted to just give a heads up for some of our technical difficulties in the chat. If you want to put your name, if there's a way to type it in, you can type in your name, because unfortunately, with some of the technical difficulties, it looks like one person is making all the comments, and that's not the case. Love seeing the comments. It's really helpful, the feedback, since we can't see all of each other's beautiful faces. So continue to encourage you to put that in the chat, but you can also put your name because it's coming up as that one participant. For our next part, we're going to move into our parent panel, our experts. We're going to have Dr. Angelique Anderson from Solano County and Natalie Berbick from Contra Costa County, and some of our parents in a question and answer type of parent panel.
Thank you so much, Michaela. Again, my name is Natalie Berbick, and I'm with Contra Costa County Perinatal Equity Initiative. And I'm here to welcome Apple Williams from Alameda County, Princella Woods from Santa Clara County, Davon Crawford from Solano County, and unfortunately, Anisha Johnson is not able to be here from Contra Costa County because she went into labor today. So she is clearly busy. Experiencing her contractions. And so let's all just send Anisha, good intentions in the chat as we go forward with our current parent panelists, as she is working towards delivering her baby's boy, who she's naming Justice, believe it or not. So moving on, I'd like to start with asking a few questions, and I'm going to ask the first question to Apple and Davon, and it's a question around one of the social determinants of health, and one of the stressors that impacts our social determinants of health is racism, and Black people in particular experience racism in all different types of settings. It could be interpersonal. It could be, meaning one-on-one. It could be in a system. And I'm asking Apple and Davon to speak to if you've experienced racism, and if you can just give an example or share a brief story about what that experience was like for you.
This is Apple. I'll go ahead and start. So my experience of racism was actually in the 8th grade. And what's so unique about this is because I didn't know that I experienced it until possibly 2 years later. 2 years later in 2019 when the pandemic started. So in 8th grade, I had this algebra teacher, and I was pretty much a bookworm. Kids say today, I guess, a nerd. So I would do all my homework, but for some reason I would fail all my tests. And so I was placed in a tutoring program with the teacher. And I noticed that I was not just myself was placed in the tutoring program, but all the other students that was in the tutoring program with me were all Black, women of color, children of color. And I asked the teacher, I said, can you explain to me why I got this particular answer wrong? And he would never explain to me. He just said, oh, you missed a step, but he would never take the time to show me. And 2 years ago, the past 2 years, it just came back to my mind that, oh, wow, I just experienced a moment of being of racism. And I wish I would have known at that time, wish my mother would have known. So we could have, said something to speak up in regards to that.
Hello, everyone. I'm Davon Crawford. I'll share my experience with you all next. So yes, as a doula, I experience racism personally as a doula, and I support clients who experience implicit and explicit discrimination all of the time. This is in the healthcare system, usually, from the beginning of their pregnancy, and it leads into their labor and delivery and their postpartum. Some of the things that really stand out to me is through my program as a doula, I focus a lot on educating my clients and providing them with resources and knowledge about what to expect when they walk into their birthing spaces. So what really comes to mind when I think about my clients, when they come in empowered and they come in walking in their autonomy and, you know, practicing their reproductive justice knowledge, they seem to be targeted more. And this is with coercion, this is with threat, this is with like actually going back and forth and battling, you know, this is from the healthcare providers, nurses, while my clients are actually in labor. And so also, you know, so I teach my clients how to hopefully navigate those situations, but it's not easy, of course, especially when you're in labor and, you know, that's not the focus at that time. But also me as a doula, being in those spaces, constantly being challenged. When I show up, I'm extra, you know, I'm questioned. I'm questioned more than I feel like is necessary, whether I'm a family member or their actual doula. You know, and so I've also been put in situations where I need to sign away my own autonomy as a doula, which basically takes away my right to serve my client the way that they need to be served in those spaces, to protect them and to provide them with advocacy and information. So yeah, so I also want to highlight that I support clients from all spectrums, but of course my focus is Black people and people of color. And so when I serve non-Black people or persons of color, I notice a blatant difference in when we practice our autonomy versus when my other clients practice their autonomy. It's just so unbelievable at times. So when I do go to voice this, you know, it comes from my response, you know, from maybe my audience at that time is they can't believe it. But, you know, I've had clients who've practiced their autonomy, really set boundaries with their birth plans, and they are followed up with maybe CPS, following up with some of their decisions, or, you know, it's just blatant disrespect. And I see this a lot. And so, yeah, that's just one of the things that I wanted to highlight from a doula's perspective, and just speaking for my clients as well.
Thank you, Apple and Davon. You know, I think what you just shared definitely reflects, you know, how systems can be part of, you know, initiating trauma at very young ages, as well as throughout the life course. And as a Black birthing person, you have to be aware of how to advocate for yourself in spaces where you can anticipate that there's going to be some level of racism or discrimination. So I want to thank you for elevating and speaking to your respective experiences. I'm going to pass the mic to Angelique Anderson so she can follow up with the next question.
Thank you so much. We know there's an importance of perinatal care, but that also comes with challenges. So this question is geared toward Princella. Did you feel heard about any issues or concerns that you may have had with your healthcare? And can you also add, did you have any challenges navigating the healthcare system?
Thank you. Can you all hear me okay?
Yes, we can. Thank you.
Okay. Basically, I did have challenges navigating the healthcare system simply because I experienced homelessness when I was pregnant with my child, and I had moved to another county, finally found a place to live, and I was trying to get my prenatal care, from a new primary care doctor. My situation is unique because I actually am a recipient of Medicare and Medi-Cal. And the actual healthcare system that I was trying to go through, they did not understand that at my age, I can receive Medicare because of my certain situation. And so I was denied healthcare because they failed to accept the fact that I was a Medicare recipient. And so this made it difficult for me to receive the proper prenatal care for my child. And this part of the reason was a lot of stress, but and as a result of this not being able to navigate the healthcare system, I actually was not able to receive the proper care, and I went into labor early from a lot of the stress because of that. I feel like I was not heard about my concerns because, well, one, I was trying to express to them, I have my card, I have my driver's license. You can compare the information, you can compare my date of birth, you can compare everything. That's one thing I will not lie about. I have the proof right here, and it was still denied. So I feel like I was not heard in that sense. And another sense I felt like I was not heard was because after I had my child, I tried to express, I wasn't in the proper mind frame. I do suffer from a mental illness, and I was not in the proper mind frame to basically express to the doctor that I need to be put back on my medication because I chose to not medicate while I was pregnant so that I can hopefully give birth to a healthy child and not affect them from the medications that I was supposed to be taking. So basically, I was expressing to the doctor after I gave birth, before they released me from the hospital, I was trying to express to them that something is not right. I shouldn't be scared of my child. I feel really scared because my son is he's too small, and I just had a lot of anxiety towards being a mother. And I was letting them know that something was not right. And they still in turn released me from the hospital and with no help, no goals or no follow-up appointments or anything like that. And so I feel like a lot of the issues that I had after being released from the hospital was because I was not heard from my issues and my concerns. Thank you.
Thank you so much for sharing that. And I heard a few things in what you were saying, and that was the need for integrated care, a lack of knowledge of mental wellness by your providers, a lack of education as far as eligibility, and also the need for advocacy or how you struggled with advocating for yourself, even though you were articulating what was going on with you health-wise. Thank you so much for that response. I'll pass it over to Natalie.
Thank you, Angelique. So the next question really is, what we are trying to accomplish here. We want every Black birthing person to have an optimal experience. And that's not the case presently. But we want to take a moment and just dream out loud about what the ideal pregnancy and birth experience is for a Black birthing person in California. And this is open to anybody on the panel. If you could just imagine the most amazing experience, what would that look like for you?
I wouldn't mind answering. This is Princella. An ideal pregnancy and birth experience for me would be having support. I commend these counties where they have the doula experts assisting these parents with their birthing experience. I think that is major because for part of my labor, I was in the hospital alone, and I would have loved to have that support and that education. Definitely, I believe that an ideal pregnancy would be for the hospital system or the healthcare system or whatever to actually provide any education for parents, for new parents especially, to learn basically what it is like to be a parent. What if you do what if there are any complications in the birthing experience? And what if your child actually comes out with special needs? What to do next? What are your options, and what are your rights as a parent in this state? So that just alone is just actual support system would be an ideal birthing experience for me. Thank you.
If I can add to what she just said, support definitely, and I would like to say support in all levels of wellness, which are what I like to call wells of wellness, which is my spiritual wellness, my mental wellness, my emotional wellness, my physical wellness, my financial wellness. There's this statement that my mother, she will always say, you'll miss your water when your well runs dry. And I've never understood what that meant, and I still to this day don't, but I know that I don't want the water in my well to run dry. And so I think of that as we as Black mothers need to speak up loud and clear and express our needs. And when our needs are not getting met, report it if we are able to, and know that we have the power to be surrounded by people that support us and not be against us, and remove the people that are against us. Thank you.
I love that. I love that. Your wells of wellness. I love that. And ideally just, every human being requires some support, but especially someone who is giving life. And so thank you for sharing what you anticipate that we eventually achieve through our work here in this birth justice movement, that everyone feel heard, that everyone get their needs met, their basic needs met, so that they can have a healthy pregnancy and a healthy baby. I'd like to hand the mic back to Angelique for the next question.
Thank you, Natalie. I've often heard an analogy of talking about pregnancy as like a piece of candy, and oftentimes the baby is the candy and the mom is the wrapper. And a lot of times we focus so much on the baby that we forget about mom. And so one of the things we want to talk about, as we have discussed prenatal care, we also want to talk about postpartum care. So the next question, which will be for both Apple and Davon, is what should postpartum care look like for Black mothers and birthing persons? And also, if you want to speak to the perspective of a mother, did you receive that care after your baby was born?
I'll go ahead and answer first. So I can only speak on what I need in my postpartum care, because every mother's needs are different. Every pregnancy is different. So for me, it will be 30 days of me receiving help from like a specialist, a nurse, or family member who is just watching over me and assisting me with my healing process. Postpartum care for me is catered to the needs of the mother, because not only did she give birth to a baby, she just gave birth to a new version of herself. And she needs that time and space to go through that process of embracing it and accepting it. And I can give you an example. My husband, who I love dearly, when I had my second child, I did not put together no postpartum plan. I wish I did, because when he took off those 30 days, he thought those 30 days was just for him to just relax, But I had to explain to him, I said, look, I'm healing. I had a C-section. There's some things that I'm going through personally, emotionally, physically. These some things, because for one, I didn't even want a C-section. And so I have to just accept, okay, it happened. I did it. I'm fine. What now? I have a new baby. So I think it's very important that we need everyone to understand that not only are we giving birth, but we are giving to a child, but we also giving birth to a new version of ourselves. And we need that time to process that.
Thank you so much. Davon, what about you?
Yeah, so when I think about postpartum care for Black mothers or for Black birthing people, You know, I usually go back to my experience. I'm a mother of 4, 3 of which my youngest children, I had them about 18 months apart. And my experience being a young mother to them really shaped my idea and thoughts about becoming a doula and being able to provide some of those support systems that I did not receive. Yes, I did have a partner at the time. Yes, he did do the best that he could, but of course, you know, it was just limited to the 2 of us. So yes, you know, a postpartum birthing person, or, you know, a person who has just given birth, they need immense amount of care. And like Apple mentioned, it's different for everyone. But I think having just access and time to process is one of the major key factors. So I think a big focus of postpartum would look like allowing time for mothers and birthing people to just lie in. This is not, this to me goes beyond 30 or 40 days. This goes well into, you know, 6 months to a year. Our bodies, like Apple mentioned, we need time to heal and we need time to recover. So just having, again, more time and access to resources, access to support, you know, having community, having access to doulas or extra support people. When I was, you know, when I was going through my process in postpartum, I was afraid to, you know, ask for support. I didn't feel like I had community members that would help me. So to me, I look at that as kind of a mental barrier. So we also need mental support, you know, therapeutic support, because, you know, as I think about it now, I find myself encouraging my clients to reach out to, you know, their family members in their community, because there are actually people out there who want to support. So yes, a doula could be your aunt. It could be your mother, your sister, or your cousin. So I think just allowing time for people to having, again, just having people around you to, I'm sorry, I'm kind of losing my thought because I'm processing so much, but just having access to people who can help prepare meals for you, you know, be around for you to just share your birthing story. These types of things go a long way. Again, having access to therapies and different healthcare related resources, because many things come up in the postpartum. It's emotional healing. It is physical healing. Again, I want to focus back on time. We need time to bond with our babies and to replenish our bodies. I think for this question, I really want to highlight that we need time to actually heal and to support ourselves at the maximum capacity in order to really change this postpartum experience. Because as we use that time, we come up with more creative ways. And we really realize what we need as, you know, people who have just given birth. And you do that again with the time where you spend reflecting, journaling, finding new hobbies. Like I said, you develop ways, you develop ways and ideas on how you need support. So just allowing that access for us to be able to access the things that we actually need.
Thank you so much. So I definitely heard a theme of being humble and not having a cookie cutter approach to postpartum care, as each mother's or birthing person's preference and needs might look differently. I'm going to pass it over to Natalie for our last question.
Yeah, and I just wanted to comment briefly on what was said. I don't know if everybody knows that most Black women Black birthing people after giving birth typically go back to work within 6 to 8 weeks after delivering. and which is not a lot of time. And our last speaker really, emphasized that you need time to heal. And the way our laws are set up in this country is that you don't have time. And a lot of Black parents don't have the luxury of time. They have to get back to work so that they can provide for their families. And is that humane? Is that really something that we should continue to uphold as a standard? I know there's some legislation about expanding paid family leave in not only in our state, but also across the nation. So it's really important that the time is something that we can advocate for, not just, with your family, but, federally, it needs to be codified into law that birthing people get time to heal. So the last question I'll go into, and this is also open to any of our parents, it's regarding this campaign, the Deliver Birth Justice campaign. What are your hopes and aspirations for this campaign? Where do you see this going? We're starting something great here, but what do you envision for this campaign in the future? Anybody can respond to this.
It's Apple. So for me, I hope the Delivery Birth Justice campaign makes people globally aware of the birthing injustice that people of color face. I see billions of people stirred up to change their behavior towards pregnant people in general, and in turn take and honor women giving up so much of themselves to be chosen vessels to bring forth life into this earthly realm. More respect added to just being a woman, and more people involved in saying, okay, what can we do to make this birthing journey a slice of heaven on earth? Thank you.
I love that, a slice of heaven on earth. Would anybody else like to respond about where they see this campaign going?
I would like to add to that. This is Princella. Basically, I just hope that that more people become educated on, basically the experiences that us people of color actually go through, in the birthing process. And I just want people to be more educated about, their rights. I love, like I said, I love this doula idea and having it expand to different counties. I pray that expands globally. I just want education for everyone. That's all I have to say. Thank you.
Yes, and someone else raised their hand, but it's still showing up as the same person. I know it's not Camila, it's somebody else. So you can unmute yourself. Okay, hearing nothing, I again wanted to just uplift and give the parents an opportunity to speak to what their dreams were for this campaign and the impact that they envision the Deliver Birth Justice campaign to have in our communities. And we heard directly from them. And if we have time, I think, for like one question to the parents from the audience. You can ask your question in the chat or in the Q&A box, but this is your time to ask the parents directly about their experience. We would love to hear from you. Okay, well, I'm not hearing any presently, but I do see that someone hopes that that this campaign brings awareness and change so racist physicians are eliminated. I feel that's really powerful. And we want to make sure that We provide a safe space for all birthing people so that they can express their truth and then they can exercise their rights. And really so that people can see that this issue is rooted in so much more than personal behaviors. It really is rooted in structures that are cumulative over the life course for Black birthing people. So moving on, we'd like to go on to the next segment.
Okay, we had an artist we would like everybody to have some art and joy involved today as well. Besides our technical difficulties, we do have a couple of artists that are sharing the space with us today and going to share with us their talents. For our first one, I'd like to introduce Tongo Eisen-Martin. He's a San Francisco native poet and a Black community fixture. He's the founder of the Black Freighter Press. He has many accolades: California Book Award 2017, American Book Award 2018, and he is San Francisco's 8th Poet Laureate. We are lucky and fortunate to have him today, and he's going to share some of his poetry with us that is rooted in racial justice and equality. So without further ado, I would like to introduce Tongo Eisen-Martin to you all.
Much love, everyone. I'm so honored to be with you all. The poetry of the future is written by mothers who know your memoir by heart. A revolutionary's laughter that becomes side door of the universe explains our take on liberation, in part, the invention of a new motherhood and the new universe to host it. With giant steps, she learned how to use knives in America. In a red summer state of spirits, also pigeon imperialism expressed through a rose period. I like this side of the city, the side that queen mothers watch over. Pick up the gun, learn something about your mind. A phone rings in 1988. An epoch begins after a mother hangs up. What else is there to do besides stop singing? Write letters, then sit still. Post-proletariat mothers make coming outside worth being followed through the low-end Q empire. And a monolith of mothers carrying babies from one side of the holding cell to the other. A mountain moved into the mass soul. See a mother, the first Sabbath after losing her job, walk and wheeze. Don't look for nuanced manifestos. Walking around the world with this fire. My mother doesn't care about your White House refund, your utopia meetings. Devil been ducking her for decades, devil hiding with puppet presidents, turning wine into humans. And there she was, keeping pace with electricity. A crowded room singing the perfect blues. Fidel near a kind word, nuclear ego on the chopping block. Friends in need of a martial art. A young woman sings a fugitive set list. She sings poetry is a mother's pain, as are most things avenged, an atmosphere of close calls. Or the whites of soldier eyes made more communal, pigs attempting to skip history, meeting makers wearing shades of an acceptable minor key, in industrial wine of return, pull. A mother goes straight to heaven and back, pull. Let's raise that boy on a rack, roses on a bullet, right hand stop engraving after that. Clenched jaw gains a reckoning, the point of creation, to keep talking about the people. I don't think I'm being followed, Mom. Maybe studied a little, because the military industrial complex has the lower ninth on a string. We look for you there. On all paths, revolutionary, we have spirits who talk to and through you. Federal surveyed early dinner in the foothills of ancestor possession, sleeping outside your body, mulling over revolutions. My mother cried during holiday massacres. Another has worked them all. kicking a hatchet down the street, then all around a city, a grandmother's Milwaukee, or the guys my grandmother robbed. Fresh faces in the spirit house put behind the sun. I asked my grandmother, why don't you ever talk about your children? She said, because grandson, I haven't run out of knife handles. Never worry, your siblings will know you right away. My grandmother got married in secret at the Black Power Conference, wearing modest underground clothes, good books floating around the room, talking about no unclaimed cremated mothers this year, no collateral white skin, no mothers folding clothes to a corporate park preamble, no children singing under the bright lights of a lumber yard, no jail barges on a mother's dinner table, quantum Reaganomics and the tap steps of turning on a friend. The music is helping, mama. Only made of light now, like a memoir ends, ready to tutor in imperialist blood, ready to improve our applause. I mean, your living room I have earned, and my great-grandmother is here too, and she soldiers every night by hero children and other things rising. I collect what she has heard. I collect what she has earned, and here no one surrenders. I can run to any rock. I have a mother where there was and will be fire. Thank you all.
Thank you, Tongo, for those moving words and honoring the mother. This campaign is centered around Black women and mothers, but also the family and the fathers and the uncles and the whole Black family structure. So we appreciate your words honoring the mother. Next, we have Ashanti Gardner. Ashanti Gardner is a graphic recorder. Oh, okay, there she is. You can see her face. Today, she has been actually listening in and capturing the conversation in a visual piece of art. I believe she's going to be able to share what she's captured so far. And so I think she's going to be able to share her screen, hopefully, if all the Zoom energy it goes in our way. She's going to be able to share her visual interpretation.
Yeah, I'm here.
Okay.
Oh, sorry.
That's okay.
Oh, are you showing my screen? Or got me pinned?
I stopped sharing, Ashanti. You
You
can share
did?
your screen now.
Oh, perfect. Okay. I'll just share my screen. It's easier. So yeah, this is what I captured today. Sorry, I'm having my own technical difficulties. But yeah, this is just what you guys have been talking about today. So just capturing, so part of graphic recording is to capture the words and visuals. So as you guys were talking, just capturing the county the opening marks, the county contributions. You guys talked about different policies and looking forward to building on those. Housing affordability, how might we create stability? So just capturing some of the questions in the parents panel, panel. I'm just talking about the different various topics, racism, navigating healthcare, pregnancy, ideal pregnancy, birth, and postpartum care, and just some of your hopes. So, but I'll clean all this up and then I think they'll share it out with you.
Thank you, Ashanti, for capturing that. It's nice to see a visual artistic perspective of all the things that we're talking about. And in this new Zoom world that we're living in, to be able to see an interpretation of all this stuff that's so detached from what we're normally used to. So that's beautiful. I'd like to let everybody know who's still left on the call. Thank you for hanging with us today, despite the technical difficulties, but we're going to launch a poll in the chat. If you can give us some feedback, I think it would be super helpful for us. This is kind of our first celebratory webinar that we've done. And so if you can just take a couple of moments to fill that in so we can have that feedback, that would be super helpful to us. So I'll give you a minute or so to kind of answer these questions. In the interest of everyone's time, I'd like to start to kind of give some kind of appreciations for everybody who attended today. Thank you for joining us this afternoon and hanging with us again through all our technical difficulties. You can continue to kind of work on that poll. It looks like the poll is still up. So let's see, give you guys another minute. Okay, we're gonna move also into calls for action. So all of this today, it's like we want you to take something from this. And these are things that you can also find on our website. These are calls to action for depending on what group you fall into. We have for Black mothers, fathers, and family members, a call to action we have is you can know your rights. There is a birthing, billing people of rights. This is a real tangible document that exists, and it's a quick guide explaining how to advocate, speak up, and get help if something does not feel right. So we encourage Black mothers, fathers, and families to know that these things exist and to advocate for yourself and become aware of this Birthing People Bill of Rights, the right that you have to choose your birth setting, that you have the right not to be separated from your baby after birth. So just becoming familiar kind of with your autonomy to your rights as a birthing person and as a supporter or a family member of a Black birthing person. For healthcare professionals, one call to action we have is that you listen, trust, and respond urgently to Black mothers and their families' concerns. A lot of times you may hear about these things called microaggressions. They're not always micro, they can be macro. These things are not so small and subtle. So we're asking healthcare professionals to actually listen and trust and urgently respond to the concerns and questions that Black birthing people are asking. For city and county state policymakers, this was more informed through our community focus groups, and it was identified through the community that funding, sustaining, and maximizing resources for CBOs dedicated to improving Black maternal health outcomes, especially during COVID, is key. So again, this is driven by the community that they're asking for support for CBOs and grassroots organizations that are working to improve Black maternal health outcomes, especially in these COVID times. We want to say thank you also, again, as we close out, to all the participants today, to all the Black birthing people who shared their experiences that informed this campaign, to the parent and doula expert panelists, to Bay Area Regional Health Inequities Initiative, to the Black Women for Wellness in Los Angeles, to Tongo Eisen-Martin, to Ashanti Gardner, to Change Consulting, to Gawapale, one of our spokesperson, the California Department of Public Health, all of our audience members, our community, Black Infant Health, and everybody who decided to join us today to listen, to respond, and to take the time out. We'll be sending out a gift as well. We have a playlist that was put together by the team. So hopefully you can take it and have something. It's a jamming playlist, and it will hopefully remind you to deliver birth justice. As we leave and close out, if anybody wants to type into the chat exactly how you're going to deliver birth justice, it would be greatly appreciated. And if you don't put it in the chat, we just hope that you leave the day thinking with how you can deliver birth justice and help us with this movement. Thank you, everybody, and enjoy the rest of your day.